Good evening, everyone. I hope you all are doing fine. Shubham Bhardwaj, hello. Soumya, hello. Hello, good evening. Good evening, everyone. I hope I am audible to all of you. So, I hope there are lockdown relaxations in many places, and now we all are, moving on. So, I hope you all are fine, doing good. Bosir Ahmad Khan, hi, hello. Jay Nandini, hi, ma'am. Muhammad Shibil, guys, is Angelina Malayali. Yes, I am Malayali. I'm from Kerala and I was brought up in Mumbai, Navi Mumbai. So basically, I know Hindi, I know Malayalam and English. So today's live is a question answer session on cerebrum anatomy that is based on the video that I had uploaded yesterday. So I hope you all have gone through it. And now there are 25 people live. Thank you so much for joining my live today because this will motivate me to make more videos. And out after discussing the questions, after I'll be putting forward some questions, and after we discuss those 10 to 12 questions, I'll be telling you about the important questions that can be asked in the exam and how to answer them as well. I completed my first year with good marks. Congratulations. Thank you so much all for your support. 36. So shall we start with the question answer session? Is everyone ready? I'll start with each of the questions now. Hi, Jane Nandini, had your lunch, ma'am? Yes. Can we start with the question answer session? Okay, listen. Good evening. Hi. 60 people are live. Thank you so much for joining my live. Now, before starting with the question answer session, let me tell you that we all know that, Air Force, the Army, Navy, they are all, rigorously trained and they become officers. They're taken into the Army, Navy. Similarly, we as health professionals, we are in future we're going to be doctors and allied health science professionals. So we are actually going to be the frontline workers, or the frontline warriors. We have to face a lot of challenges that will be coming across us. So it's our responsibility right now as a student to understand all the concepts that we have to learn. So that is our responsibility. So I like now 71 people are live, and I believe that those of you who have joined this live, you all are very responsible, and it takes a lot of willpower to go through to study and focus on your work. It's easy to get distracted, but to focus on our responsibilities to become a good health science professional is what makes us a good doctor or the allied health science professional. So that is what we are showing, our responsibility, our honesty towards our work. So okay, so shall we start with the question answer session? Good evening. Okay, so if you all are ready, please say yes. Okay. Nidhi Yadav, yes. Deep Patel, yes. Okay, I'll start with the first question. Shall I? Okay then. The first question is, what divides the cerebrum into the right and left cerebral hemispheres? I'll repeat the question. What divides the cerebrum into the right and left cerebral hemispheres? There is a structure that I mentioned. So, sagittal plane. No, there's a more specific term that's used. There's a structure that divides the cerebrum into the right and left cerebral hemispheres. Corpus callosum. Okay, corpus callosum is a structure that joins the right cerebral hemisphere with the left cerebral hemisphere. Okay, there's corpus callosum. Okay, any different answers? What is the structure that divides? It's actually a fissure. What is the name of that fissure? There's a fissure that divides the cerebrum into right and left cerebral hemisphere. Yes, Bomia has answered longitudinal fissure, medial longitudinal fissure. So yeah, all the people who have answered, Good. Thank you so much for answering, for participating in this. Now, the answer for this is medial longitudinal fissure. The medial longitudinal fissure divides the cerebrum into right and left cerebral hemispheres. Corpus callosum is a structure that joins the two. Now, the second question. What are the two subdivisions of the inferior surface of the cerebrum? We learned about the inferior surface. Now there are two subdivisions that we learned in the inferior surface. Which are the two subdivisions of the inferior surface of the cerebrum? I'll repeat the question once again. What are the two subdivisions of the inferior surface of the cerebrum? Orbital part. Yeah, you have answered orbital and tentorial. Baswaraj, Preeti, yes, you've answered it right. It's orbital part and tentorial part. Okay, that's good. Okay, fine. Okay, so the second question is done. So the two subdivisions of the inferior surface of the cerebrum is the orbital surface and the tentorial surface. Okay. Moving on to the third question. What is the anterior part of the inferolateral border of the cerebrum called? Orbital and apurva, orbital and tentorial. Okay, done. Okay, that's the right one. Third question. What is the anterior part of the inferolateral border of the cerebrum called? Fascia. No. Orbital surface and tentorial surface. Third question is, what is the anterior part of the infralateral border of the cerebrum called? Apurva Gajula, superciliary border. Yes, you're right. Thank you so much for, actively participating. Preeti Setumani, superciliary border. Yes, exactly. That's the answer. Superciliary border is the anterior part of the infralateral border of the cerebrum. Pratham Kadu, a superciliary body. Oh, superciliary border. Okay, fine. Moving on to the next question. What are the three areas that the inferior frontal gyrus is divided into? So that's an interesting part. We learned three small areas that the inferior frontal gyrus is divided into. What are the three areas that the inferior frontal gyrus is divided into? We learned that the lateral sulcus divides it. Don't know. Okay. I'll repeat the question. What are the three areas that the inferior frontal gyrus is divided into? Central sulcus. Come on, you can. There's three small areas that the inferior frontal gyrus is divided into. It was in the frontal lobe. Orbital, triangular, opercular. Yes, J. Nandini has answered it almost correctly. Any more answers on it? More answers? Anterior, horizontal, anterior, assisting, posterior. Those are the rami of the lateral sulcus. It divides the inferior frontal gyrus into three areas, and those three areas have names. What are the names of those three areas? Opercularis, pars, yes, Apurva Gajula, J. Nandini, Apurva Gajula has answered pars orbitalis, pars opercularis, and pars triangularis. That is the answer. The pars orbitalis, pars triangularis, and pars opercularis are the three areas that the inferior frontal gyrus is divided into. Okay, Pratham Kadu, Lakshmi. Okay, all have answered. Thank you so much for actively participating. Okay, now the next question. Name the gyrus that lies between the corpus callosum and the cingulate sulcus. I hope this will help you all to revise what you have learned, because on the basis of these concepts, we are going to study the other parts of the cerebrum as well. Like we have to move on with the functional areas of the cerebrum. So only if we know these concepts, it will be easy. So name the gyrus that lies between the corpus callosum and the cingulate sulcus. Cingulate gyrus. Yes, exactly. Jubi Jeffen cingulate, Anu cingulate gyrus. Sai has answered cingulate gyrus. Cingulate, Baswaraj and cingulate. Okay, fine. So the answer is cingulate gyrus. Yes, it's seen on the medial surface. Now, next question is, name the triangular area between the parieto-occipital sulcus and the calcarine sulcus. I'll repeat the question once again. Name the triangular area between the parieto-occipital sulcus and the calcarine sulcus. It's an interesting name to it. Gyrus. Okay. Now, next question. I'll repeat the question once again. Name the triangular area between the parieto-occipital sulcus and the calcarine sulcus. Okay, the answers have come in. Apurva Gajal has answered cuneus. Deep Saha, cuneus. Anu Sohan has answered cuneus. Cuneus. Okay, fine. Zahida, everyone has answered it. Okay. Thank you so much. Again, I'm emphasizing because, when you all take your time out to come and answer the questions, it means a lot to me. So, yes. Next question is, now there are almost 4 to 5 questions left, after which I'll be talking about the important questions. So, what is the sulcus that divides the post-central gyrus, okay, post-central gyrus into the superior and inferior parietal lobule? My next question, I'll repeat once again, which is the sulcus that divides the post-central gyrus into superior and inferior parietal lobules? It's a sulcus. It's a sulcus that divides the post-central gyrus into superior and inferior parietal lobules. Yes, Deep Saha has answered it, intraparietal sulcus. Judy has answered it, intraparietal sulcus. Okay, fine. They've answered correctly. Fine. Now moving on to the next question. Rahul has answered it, intraparietal sulcus. Okay. Now moving on to the next question. The sulcus that divides the orbital surface into anterior, posterior, medial and lateral gyri. Intraparietal sulcus. Okay, all the answers have come in. Okay. There are just few more questions, after which I'll be discussing the important topics and how to answer them as well as how to remember them. So, just a few more questions. The sulcus that divides the orbital surface into anterior, posterior, medial and lateral gyri. Which is that sulcus? Did you all get my question? The sulcus that divides the orbital surface into anterior, posterior, medial and lateral. It's actually sulcus. Okay, I'll tell the answer. It's edge-shaped orbital sulcus. The edge-shaped orbital sulcus in the orbital surface divides it into anterior, posterior, medial and lateral gyri. So that's the answer for it. Okay, now an easy question. It's about the corpus callosum. Which are the 3 parts of the corpus callosum? 3 main parts. 3 main parts of the corpus callosum. The next question is, which are the 3 main parts of the corpus callosum? Cuneus. Which are the 3 main parts of the corpus callosum? Genu, body and spleen. Yes, it's genu, body and spleen. Anu Sohan has answered it. Genu, body, rostrum. Genu, spleen. Okay, rostrum, genu, spleen. Okay. All the answers are coming in. Okay, fine. Okay. Now, do you need more questions? There are 2 more questions remaining. So after that, it will be done. So next question, last 2 questions. Name the area around the parieto-occipital sulcus. The area around the parieto-occipital sulcus, it has a name, a particular name. I'll repeat the question. Genu, body, splenium, all are answering the earlier question. It's nice. Thank you so much for participating actively. Okay. Name the area around the parieto-occipital sulcus. Insula precuneus. No more answers. Come on. Yes, Lakshmi has answered. Very nice. It's arcus parieto-occipitalis. It's arcus parieto-occipitalis. Okay. So that's done. Lakshmi has answered it. Now the last question. The last question is, name the indentation on the infralateral border about 5 centimeter in front of the occipital. We learnt about a particular notch that was seen in the infralateral border, almost 5 centimeters in front of the occipital pole. What is that indentation called? What is the name of that indentation? This is the last question. Pre-occipital notch. Anu Sohan has answered it. Pre-occipital notch. That's the correct answer. Anu Sohan. Okay, thank you so much everyone for actively participating and answering the questions. It means a lot. Pre-occipital notch. It's pre-occipital. It's pre-occipital notch. Anu Sohan has answered it. Himanshu, Devika, pre-occipital notch. Okay. Preeti, Pratham, Abha. You all have said the right answers. Thank you so much. Thank you so much. Okay. Now, after the question answer session, now the question answer session is done. So we look at the important questions. Now, it's for the video, on the basis of the video that I prepared earlier, that is the cerebrum. It consists of the sulci, gyri of the cerebrum. So that is actually the basic thing. Now, in the further videos, I'll be explaining about the functional areas of the cerebrum, the thalamus, white matter of the cerebrum, and so on. So for now, I'll be just telling about the important questions of neuroanatomy. That is, first is the sulci and gyri, and along with it comes the functional areas of the cerebrum, the blood supply to the brain, the circle of Willis, then the cerebellum, cavernous sinus. All these are important questions in general. The spinal cord, its tracts, the cranial nerves, the ventricles. I've already made the videos on the ventricles earlier. So everyone has been answering. The which you are in, Aditya Kumar. I am in final year, Bachelor of Physiotherapy. Okay. So those are the important questions in relation to the neuroanatomy. Now, as far as this video is concerned, that is the last video, that is of the cerebrum, what you can expect is the questions relating to the functional areas. Before that, if at all there is a question, ask for 15 marks. For example, write about the sulci gyri of the supralateral, sulci and gyri of the supralateral surface of the cerebrum. If this question is asked, we need to write it. So in order to write it, first we'll be writing about the introduction to the cerebrum. Then we'll be writing about the lobes as well as the sulcus that divides it, as I explained earlier in the video. So we'll be writing about the sulcus. Then moving on, we'll be taking each lobe. And before we move on to the lobes and its sulci and gyri, we have to draw a diagram. Now the diagram is the one that I used in the video yesterday to explain the sulci and gyri. It's actually easy. If you ask me how to draw it, it's actually easy. You have to make it just as shown. It's not complicated actually. It can be easy. You just have to mark the important sulci and gyri. If you know the sulci and gyri, if you can remember it, then that will be the easiest way. You can just draw a central sulcus. In front of it, you have the pre-central sulcus, post-central sulcus, and for the sulci and gyri for each lobe. So once you have the sulcus, you can remember the sulcus, the gyri becomes easier. So that's how you can label it. Now, moving on, after writing about it, the next you can write about the frontal lobe and the sulci and gyri in it. If it is a long question, that is an essay question, like a 15-mark question, you can elaborate and write it. Along with it, you can draw the tabular form that includes the sulci, gyri, frontal lobe, just as I showed you in the video earlier. So, which book do you follow for anatomy? That's B.D. Chaurasya. B.D. Chaurasya, and the Asclepios Atlas of Human Anatomy is the one that I use it because most students use it. It's a simplified textbook, so I refer to that mostly. Okay, so as I was talking, how to write the answers. So if this supralateral, if the sulci and gyri of the supralateral surface of the brain of the cerebrum is asked, you have to write it like that: the introduction, the diagram, then the frontal lobe, about its sulci and gyri. Then comes the temporal lobe or parietal lobe, occipital lobe. You have to mention each of this in detail. Now, when we talk about the in detail, it's good if we write it in a point-wise manner. We highlight the important points, write it in a point-wise. Instead of writing the entire thing like an essay, we can put it into points with headings and drawing diagrams wherever possible. Like if you draw a big diagram with all the sulci and gyri, that will be clear enough. So that will fetch us marks. So moving on, that is how we have to answer it in a 15-mark way. Now, for example, if it is asked in a 10-mark or a 5-mark question about the sulci and gyri, only about the sulci and gyri, then you can actually write it in the tabular form, like frontal lobe, its sulci, gyri. In that way, we can write about it. So there is no need to elaborate on it more. So that's about the writing the answers. That's how we have to write the answers. Now, So that's done, how to write the answers. And moving on in the coming, so I'm happy that so many people turned up today and answered the questions, the question answer session, because that shows your interest towards the subject, and you are being responsible towards your profession. So thank you so much for to all who joined this live and answered the questions. Now on the basis of this, you can actually find it easy to learn the further topics, that is the functional areas of the cerebrum. Now I'll be uploading the video for that in the coming days. Now another question is that how do you remember? How do we remember, and how do you remember the things? Now, basically, on my personal experience, I have been trying a lot of different ways to recollect content. There are a lot of ways. If you search on the net, search on YouTube, there are a lot of different ways in which we can recollect and how to remember easily. But personally, on my opinion, we all have a different method of learning. Some people can learn it through hearing, some can learn it through visual, by seeing diagrams it becomes easier. So personally for me, when I look at diagrams, it becomes easier for me to learn it personally, even if I don't like drawing. But that visual capturing, that is where my thing works. So that's how I remember. So for you all, you can actually, if you are a person, a visual learner, you can actually, if you want to learn about the cerebrum, its sulci and gyri, the best thing is to take a good diagram, learn about it, fix it right in your mind. Now for some people, this the visual content does not work well, so they can try out with mnemonics. If you want to learn about cell kind, that is the reason I explained the diagram, as well as in the diagram, and I showed you the sulci and gyri, as well as I included the mnemonics. Okay, so it depends on you. You can create your own mnemonic, short mnemonics in your own language, whichever is comfortable to you, but make it funny enough so that you can remember easily. So that might help some of you. Okay, so that might help some of you, so you can use that way to remember the details about the cerebrum. Now I'm talking in context with cerebrum, but you can use the same concept in other topics as well, other anatomy topics as well. Now if you all want me to make a detailed video on how to remember things, or how to recollect what we learned, I can make it. But it depends. It varies on each and every individual, because some people, like I personally tried out. I recorded content. If you take your phone, and if trying to study a topic, and you're going to record it, and then after some time, before while revising, if you hear it, some people find it easy to remember the things. Now, for me personally, that did not work, because I'm not a audio learner, audio type of learner, but the visual one was. So then apart from this audio, visual, and all of this, there are different techniques like the Feynman technique, mind mapping technique. You all can try it out. Whichever works the best for you, use that technique. So that's what I had to tell about recollecting, how to remember and write things. And no matter which technique you use, revision is the core of all of it, because we people, we only some a few students are there who regularly revise the content, and that's why they can recollect it really well at the time of exams. So even though it's a bit difficult, if we try, we can uh, you know carry out a good pattern of revision in a week itself. There is a a thing called, if you study now, after 5 hours you should revise it, and after a day you should revise the same thing. For example, if you're studying cerebrum today at this time, tomorrow at the same time, just go through the content. After 2 days, go through the same content. After a week, after 2 weeks, after 1 month. So in that way, it will stay in your long-term memory. So that is what I had to say about remembering and presenting the content. So that's all I had to share in this video. If you want me to share about the detailed techniques and ways, I can do that. And okay, now let's look at the comments. So I don't know. Okay. Okay then. So right now there are 57 people in the live. Thank you. Please share your notes for anatomy. I have uploaded it in Instagram. You can check it out. If you all need any other notes on biomechanics, I'm working on a certain notes of all the subjects like pathology, biomechanics, psychology. And if you need any of the notes, you can contact me on my Instagram page or leave me an email. Okay. So I'll be answering all of it. Okay, so I hope you all have got an idea of how to, got a basic idea about at least the cerebrum and sulci and gyri. And in the coming days, I'll be uploading more about the cerebrum, about neuroanatomy, because neuroanatomy has been the subject that everyone has been asking a lot. So I'll be uploading about neuroanatomy as well, like more topics. And I would like to come live like this, so please do tell me if you find this helpful, this question answer session, so I can come with few questions, and based on that particular topic that I'll be teaching or explaining, I'll be sharing the important questions as well. So if you need that, if you find it helpful, I will be doing the same in the coming days. White brain internal capsule. Yes, Maithili Bhaskar. I will be making videos on it soon. Thank you so much. These videos has helped a lot. Marco Cameroon. Thank you so much. Thank you for your support. How do I study electrotherapy? Electrotherapy, it's by basically having an idea about the equipments that we are using, TENS, ultrasound, by that, and the concepts, the principles are the ones that are important in electrotherapy. The principles of working of the equipments, as well as different positioning of the electrodes. I'll be talking about it later. Cerebral. The cerebrum is situated in which region of the brain? Cerebrum occupies the anterior cranial fossa, middle, and the posterior cranial fossa, the entire cranial fossa. I had shown a diagram in the video earlier. Keep it up, ma'am. Thank you so much. It's very useful. D, please make on oral cavity. Yes, sure, Shilpa. I'll be working on it. I'll be focusing more on neuroanatomy, but along with it, I'll be posting videos for other topics as well. Live videos help us to revise these topics. Yes, thank you so much. One person turned up, Pratham Kadu. Live videos help us to revise these topics. So if this really you find it helpful, if you find this live session helpful to revise the topics, then please do let me know. Then I'll be coming up with more videos as such. Please make live videos, ma'am. Yes, sure. But like in live videos, I won't be able to share the content. In live streaming, there are few problems that come in because of the network issues and all, and that's the reason I come up with the live sessions. So teaching is more effective because it will be coming as a video, so it will be good. So I'll do that for the videos. Please give notes for first year. Please make videos about brachial plexus. Rashid Ashraf, I have already uploaded a video for brachial plexus anatomy. You can check it out on my channel. Please conduct the same live session more and more. So yeah, sure, I will. I'm really happy that you all turned up and you participated, stayed there with me throughout the entire live session. Thank you so much, everyone. Hi, ma'am. Please prepare notes on hand muscles. Yes. Sure, I will. I have already prepared a video on the same, the muscles of the hand. Okay, so I think that's done. Okay, so shall I end the live session? I'll meet you all in the after the next video. I'll be coming up with a live session for revisions, as well as sharing some tips that I know personally, as even I'm a student, but still I can help you out with whatever content I have with me. Hi. Thank you for helping us, Pratham. Thank you so much for your support. You're welcome. Please put regular videos for first year MBBS. Yes, sure, Kartika. I'll be working on it. Okay. So now I'll end with the live. Thank you all. Thank you so much for turning up. It means a lot to me. Thank you for being there with me in the live. I'm going to end the live now. Thank you all. Justin, thanks, ma'am. You're welcome. Ramjina, thank you, ma'am. You're welcome. You're welcome, everyone. Thank you. Bye-bye.